It has never been more apparent just how important science communication is than during the COVID-19 pandemic, where experts in virology, public health and epidemiology have been providing regular commentary to the public. Today, I'd like to share with you some of what I have learned about communicating science during a pandemic. Not only for those that might want to get involved, but also for anyone that has seen a scientist on the news and wondered why we do it. I've attended a couple of communication courses over the years, and one thing that has always bothered me is that we're told to focus our talk to a specific audience. Am I talking to fellow scientists or to the general public? But why can't it be both? Science is universal, and everybody deserves to understand it. The whole world has been watching as the research around COVID-19 evolves. And I think we can all agree that there hasn't been such constant media coverage of a topic than there has about this pandemic. People are watching as science plays out in real time in a public forum, and while that presents opportunities to learn and to discuss and debate ideas, it has also contributed to the rise in science denialism and conspiracy theories. If we recognise science communication for the powerful tool it is, and encourage and train future scientists in how to discuss their work with their community, we could effect real change and see a return to the public's trust in science. Pandemics are nothing new. They have occurred throughout history, and with them, there have always been people that have sought to discredit scientists. But the pandemic we are currently living through is the first to occur in the age of TikTok. A quote from the Irish writer Jonathan Swift is, "Falsehood flies, and the truth comes limping after it." One look at a Facebook or Twitter timeline shows just how true this is. False information and fake news are more likely to go viral on social media. And once they do, it is almost impossible to undo all of that damage. Interestingly, TED actually have guidelines for what you can talk about on this famous red dot. I couldn't stand here and discuss unproven pseudoscience to whoever may be watching, but hugely influential people and even world leaders or ex-leaders can say whatever they like, knowing that their tweets will go viral and that a lot of people will listen. So how do we counter the misinformation that is out there? The answer is actually pretty simple. Scientists need to talk to people. We need to engage with the media, with the public, with policymakers and politicians, and with scientists that hold opposing views to our own. Before 2020, I was researching how respiratory viruses make us sick. I do a little bit of science outreach on the side, taking part in science festivals and going to schools, trying to convince kids that they should study viruses and that it might actually come in useful someday. Then, in February, I received my first media request. They asked me to comment on a new respiratory virus causing a few cases of pneumonia in China. I turned this down. I didn't think I was old enough or had enough experience, and I worried that people wouldn't take me seriously because I didn't have professor in front of my name. But after further consideration and some very insistent journalists, I realised that I shouldn't treat this any differently to the science outreach I was used to doing. Sure, the audience might be slightly older, but the goal is the same: to communicate science in a way that can be easily understood. Over the past year, I've taken part in hundreds of media appearances, and believe me, it can be tough. Sometimes I just want to go back to tweeting about the Great British Bake Off and what my current favourite song from the Hamilton soundtrack is. This time, we're talking about a pandemic, but next time it might be an earthquake or a black hole or a return to discussing climate change. And we need people that can comment on any eventuality. And for those future experts, I'd like to share a few of the things that I've learned about communicating science that I wish I knew at the start of 2020. Number one, get involved. Take part in local initiatives like festivals and career days. Contact your institution or company press office or communications team and tell them you're willing to comment on certain topics. And be active on social media. Let people see what it is like to do your job. Number 2, it always takes more time than you think. Do not underestimate the time commitment that public engagement takes. Not only to do the event or interview, but also to prepare for it. Which brings me to number 3, always be prepared. Ask the producer or reporter, or host or chair, or whoever is running the event what the topic is, and if they have a list of possible questions. Make sure you know your facts, and find out if you'll be appearing alongside anyone else, and Google them. Know their standpoint on an issue. Number 4, you can never be completely prepared, but that is okay. It is okay not to know something. In fact, it's a good thing when you're honest about it. And number 5, it is okay to say no. I find this one quite tough. I struggle to say no when someone asks me for a favour. But if it is something you do not feel confident doing, say no and maybe suggest a colleague. And remember, science outreach is a skill. It takes training and practice. Not only that, but it isn't really part of our job description. Very few scientific jobs have time set aside to allow for public engagement. This is something that we have to balance alongside our other work commitments, while still trying to maintain that mythical work-life balance. Thankfully, attitudes are starting to change. Research institutes and funding bodies are recognising the importance of the public trust in science. Because science alone cannot solve a public health crisis like COVID-19. For the public to trust in science again, we need experts that are able to translate science into language that is easier to understand. Science needs to move with the times. We need experts that are relatable and representative to act as translators for those who haven't learned to speak the language of science. The rest of that Jonathan Swift quote that I mentioned earlier is actually, "When men come to be undeceived, it is too late. Like a physician who has found an infallible medicine after the patient is dead." Let's not wait too long to realise that communication is one of the greatest tools we have to tackle this and any future pandemics.